Do you suffer with pain, burning, tingling, numbness in your feet and hands, otherwise known as peripheral neuropathy? Then this video will mean a lot to you. Hi, I'm Dr. Gregory Kramer, Diplomate, American Academy of Medical Legal Professionals. I'm affiliated with Functional Medicine University and therefore have advanced training in clinical nutrition and functional medicine. I've been in practice over 20 years and seen over 100,000 patients. Today I'm going to give you some information on peripheral neuropathy. We're going to go over the problems, causes, and solutions to help you to have a healthier, happier life. First of all, let's go over what is neuropathy. Peripheral means away from the midline. That means you're suffering usually with your hands and feet. Usually the problem starts in your feet, and as the nerves degenerate, it can work your way up into your calves and eventually into your hands. Neuropathy, neuro means nervous system, apathy means suffering. So you're suffering with a neurological problem in your feet and hands. Many people think peripheral neuropathy is a foot problem. That's not true. It is a systemic, whole body problem. It affects over 20 million Americans. Now let's first start off a little bit about the three different phases of peripheral neuropathy. When patients come see me with neuropathy, usually there are three phases: mild, moderate, and severe. Mild neuropathy with someone who has a little bit of numbness and burning. It affects their ability to walk, maybe just a little bit. They're starting to notice that after a long walk, they're starting to have trouble. It may just barely interfere with their ability to sleep. Now, if you don't fix the root cause of mild neuropathy, then it progresses to what we call moderate symptoms. Now, moderate symptoms, you're starting to get numbness, burning, cramp-like sensations, maybe pins and needles, and sometimes pain, and it's starting to happen more frequently, and it's becoming more intense. Now, many of my patients tell me that they're having trouble walking, their balance is being affected, and their ability to participate in physical activities is being compromised. They can no longer enjoy things like golf, or tennis, or bowling, and they're starting to be concerned about their balance. You see, the number one cause of death over the age of 50 is falling. And if you cannot feel your feet correctly, there's a high probability you're going to fall. So neuropathy, if uncorrected, can lead to serious injury and serious falls. And if you start to degenerate further, you don't correct the cause and you just treat the symptom, then the moderate problems progress into severe. Now patients tell me the pain is becoming more and more severe. I have some of my patients that tell me they can't walk more than 5 minutes. They're literally a prisoner in their own home. Some of my patients tell me when they walk from carpet to salate, they can't feel the difference. They can't feel cold. They can't feel hot. Sometimes their socks feel like they're balled up underneath their feet. And the numbness and burning is causing them to have tremendous difficulties with balance. And I have a lot of my patients even tell me they're afraid to go on vacation because they're afraid that if they go dancing, that they're going to fall. And sometimes the pain can be so severe that even in the heart of winter, in a Michigan cold winter, these patients are forced to wear slippers or sandals. And also, a lot of these patients tell me with severe neuropathy that the sheets of their bed is starting to hurt them. Can you imagine that the sheets in your bed feel like little knives going over your feet? So again, numbness, burning, cramp-like sensation, tingling, those are all signs of neuropathy. Those are all signs of the nervous system being damaged. Now, what is the cause of neuropathy? Well, there are many, many factors. It's more to it than just multiple sclerosis or diabetes. Now, there's a common saying in functional medicine or even clinical nutrition circles that we treat people and not disease. And that's true. I do not treat neuropathy. I treat patients who have neuropathy. Let me explain. There could be 5 of you, 5 different patients, and each of you could have 5 or even 10 different causative factors that are causing your neuropathy. So we look at people as a unique individual. Each of you has had different physical, chemical, and emotional stresses throughout your lives. That's why we look at you each as a unique individual. Now, there's one analogy that will help you understand my approach and how it may differ from all the other approaches that you've had. Now, most of the people that I see have already had traditional and sometimes even alternative care. And obviously, if those approaches worked, they would not have sought my services. Now, we're going to use a term called the iceberg analogy. The tip of the iceberg is the smallest part of the iceberg, and that represents your disease. Traditionally, you've been seeing doctors that are experts in crisis care that are treating your disease. And obviously, if you're watching this tape, it has not worked. I'm an expert in health recovery. I do not treat the disease, I do not treat the tip, I treat the body of the iceberg. Now, the body of the iceberg is the largest part, and that represents all the causative factors, what we call physiological glitches, or these are errors in your physiology that have led to neuropathy. Now, there can be over 25 different factors that can cause neuropathy. Some of them are, you can have an autoimmune imbalance where your body is actually attacking the nerves. You can have a digestive imbalance or an absorption issue. That means even if you're supplementing vitamins B6 or B12, you may not be absorbing it. So if you could take truckloads of B6 and B12, and if you don't absorb it, it's not going to help. You can have an immune system imbalance or a structural imbalance where you actually have a herniated or bulging or degenerative disc that's putting pressure on the nerves either in your neck or in your lower back that's contributing to a hand or foot problem. You could have a nutritional deficiency or a heavy metal toxicity. Like I said, there are multiple factors that could be causing a neuropathy. The key is to test you as an individual for all the different factors that could be contributing to the abnormal physiology, or in other words, that's causing your body from healing properly. Now, the other factor that separates what I do versus what you've probably had in the past is that not only do I address the root cause of the problem, but I address all the physiological glitches. Sometimes a person goes to an alternative doctor and does a detoxification program, but that's not enough. There could be, like I said, over 25 different factors contributing to your neuropathy. They all fall under three primary categories. Structural, that means you could have a problem with your spine where the bones are pinching a nerve, or you could have a disc problem. You could have a neurological problem where one side of your brain is a little bit stronger than the other side of your brain. Or you could have a metabolic problem. When I say metabolic, I mean we're looking at your blood work from lab tests, we're looking at nutritional deficiencies, we're looking at toxicities. The key is to look at all the factors. So again, we look at the cause and we look at all the factors. We're very comprehensive in our assessment and in our treatment. Now, the treatment is to address all the factors that are negative. And so the number one goal is to find out what's causing your problem. So if you have a structural imbalance and you have pressure on a nerve due to a bulging or herniated disc, we'll do a procedure called spinal decompression that decompresses the nerves. It's very comfortable. Many of my patients fall asleep while they're on it. If you have a neurological imbalance, we will find the area of the brain and nervous system that's weak, and we strengthen it with very gentle type of brain exercises. If you have a nutritional deficiency, then we'll replenish it with the nutrients that you're deficient in, and if you have levels of toxicity, we will put you on a detoxification program. If this makes sense to you, and you're sick and tired of being sick and tired, and you would like a non-drug, non-surgical approach, then I suggest you give our office a call and set up a 30-minute consultation to see if you're a candidate for my non-drug, non-surgical, comprehensive approach. For most of you, there is help without drugs and without surgery. This is Dr. Gregory Kramer. Please give us a call for a 30-minute consult, 248-615-1533. Thank you.